Okay, thank you everybody for joining, taking time out of your busy morning. We're going to go over benefits that will be effective July 1st. At any time during the call, if you have questions, please go ahead and stop me and ask your questions. Additionally, I ask that if you could place us on mute so we don't hear any background noise, everybody has the ability to listen to the entire presentation. Few things that we're going to go over today: eligibility, qualifying events. We're going to go over the medical options, dental, vision, life insurance changes, and then we're going to go over additional coverages, and finally the deadline. Eligibility: everybody working 30+ hours is eligible for benefits. Additionally, legal spouse, domestic partner, and children up to the age of 26. As I stated earlier, these benefits will be effective July 1st. Your current benefits will end at the last day of June. So make sure if you need to fill prescriptions, last minute appointments, you get all that done before the end of the month. Since these benefits do start July 1st, you're locked in till the end of the year, which is December 31st, 2019. Our plans run calendar year, which means January 1 to December 31st. You cannot make any changes once you enroll unless you have what we call qualifying event. Such as marriage, divorce, adoption, birth of a child, loss of coverage, things of that nature. And you do have 31 days from the date of the event to notify Human Resources here at CBR of the change, and that opens up the plans for you to review, etc., add, delete, dependents. If you do go past those 31 days, you will have to wait until the next open enrollment period. The 4 medical plans that we're going to go over are all Aetna plans. They are all of them use the Open Access Managed Choice Network that you can see there on the screen. 4 different plans. 2 of them are high deductible health plans, and then the other 2 are regular copay or PPO plans. Everybody should have received a benefit guide and additional information in regards to how to find doctors, how to see if your current provider is in the network. You can follow the guide, or again, this presentation will be sent out to everybody to review with more time and in detail. We're going to go over the first 2 medical plans that are being offered. So the first plan is called the OAMC, or Open Access Managed Choice 5000 HDHP, High Deductible Health Plan, which means you pay towards your deductible with the first visit. This particular plan is a $5,000 deductible for an individual, $10,000 for the family. If you should meet your deductible, then you go into coinsurance, which means we cost share with Aetna. And then your out-of-pocket maximum, which means your worst case scenario in a calendar year, the most you will pay out of pocket for in-network services is $6,350 for an individual, $12,700 for the family. I also want to let everybody know if you've met any part of your deductible with your current carrier, Aetna will give you deductible credit. So make sure you send me your last explanation of benefit, or EOB, either printed off the website or something you may have received in the mail. Get that over to me as soon as possible so I can send it to Aetna, and Aetna will give you that deductible credit till the end of the year, which is December 31st.
Excuse me, Leticia, it's Gina. What happens if we already are on Aetna and they already would have that, but it's a different plan? Do we still need to send that in to you?
Yes, please.
Okay.
Just want to make sure that everything is updated on our end with the people that we work with on the Aetna side. Great question. No. So in this plan, you have your visits, your regular doctor, your specialist, your urgent care, your emergency room. Everything is going to be subject to that deductible. You still want to give your provider your Aetna card, so you have the lowest, you pay the lowest rate, the lowest contracted negotiated rate. Additionally, with this plan, you do have to meet your deductible prior to paying copays for your pharmacy, with the exception of contraceptives and maintenance drugs. So if it's under the FDA approved list, those medications may be free prior to your deductible. Now, if you have a question if your particular medication falls under that category, you can email me separately and I can check the formulary or send you the formulary to see where it falls. That is going to be true with all high deductible health plans. On all of our plans, the preventative care is covered at 100%. your well woman, well man, well child checks, those are all covered at 100%. Under healthcare reform, there are 63 preventative exams we're entitled to, dependent on age and gender. So make sure you have those conversations with your primary care physician. Any questions on the Open Access Managed Choice 5000? Okay, next we're going to go over the Open Access Managed Choice 6350. So for this plan, the deductible is $6,350 for an individual, $12,700. Now, if you meet your deductible, you're into 100% coverage. No, there are no more copays after that. That is going to be your deductible and your out-of-pocket maximum. Okay. Again, preventative care covered at 100%. On this plan, your office visits for your regular doctor are $25. Your specialist, your urgent care, and your emergency room are all going to be subject to your deductible. Okay. Pharmacy on this is covered prior to the deductible. It's a 30-day retail supply. Your generic medication is either a $3 or a $10 copay. Your preferred brand name drugs, $35 copay. Non-preferred brand name is a $60 copay. And then specialty medications such as injectables, 25% up to $250 is what you pay. And then if you're on any type of maintenance medication or your physician can write you a 90-day script, you can send that in via mail and you can get the 90-day supply for 2 copays. So you save a little bit of money there. Any questions on this plan?
This is Karen. I have a question regarding the first plan.
Okay.
So regarding prescription drugs, so if you have not fulfilled your deductible, you're going to pay the full price for the drug?
You're going to pay the full retail price of the drug. That is correct, unless it falls under that category of contraceptive or maintenance medication or preventative drugs.
Okay, thanks.
And you can also use your HSA account to pay for that medication. If you have an HSA now and you have dollars in that account, you can use that towards the medication. If you've met any part of your deductible or your full deductible that you have now, that's going to go towards the deductible here too. So keep that in mind. Sometimes some of the generic medication or antibiotics, things of that nature, sometimes they're less expensive without insurance. If you go to some pharmacies, Walmart, Fry's, they have those $4 generics. They have other medications that are listed under their FDA low-cost approved drugs. So that's another option. Additionally, if you can download or go to GoodRx and type in your zip code, it gives you locations where your medication is the lowest. Sometimes you don't need a coupon, it's just a lower cost medication. Any other questions? Okay, next we're going to go over the next 2 plans with Aetna. The Open Access Managed Choice 3500. Again, this is a high deductible health plan. So you start paying your deductible with the first visit. And this plan is a $3,500 deductible for an individual, $7,000 for the family. And then you go into the cost share or co-insurance. And your maximum out-of-pocket for an individual is $5,950 and for a family, $11,900. Again, all of your visits, PCP, specialist, emergency room, urgent care, and medication are going to be subject to the deductible. Again, with the exception of some contraceptives, maintenance, or preventative drugs that are on the FDA approved list, those are probably free prior to the deductible. So again, if you're taking any of those and you want to see if your medication falls in that category, you can email me. Okay, the last one is an Open Access Managed Choice 3000, 3000 being the individual deductible, 6,000 the family. Then you go into cost share, and the out-of-pocket maximum is $6,350 for an individual, $12,700 for your family. Your preventative, again, is covered at 100%. Office visits on this plan is a $40 copay for your regular doctor. Specialist is a $60 copay. On all of our plans under Open Access Managed Choice, you do not need a referral for a specialist. You can go online and look for a provider, and you can set your own appointment. You can self-refer. Urgent care on this plan is a $75 copay, and your emergency room on this plan is $250. And then the same retail prescription copays apply. And again, these are prior to your deductible. Any questions on the last plan, Open Access Managed Choice? I also want to point out that the Mayo Clinic here in Arizona and nationally is within the network. Any questions? Okay. Next, we're going to go over your telemedicine provider. It is with Teladoc. So anybody enrolled under the Aetna plans has access to the telemedicine. So you're going to see regular board certified physicians available 24/7, 365. I highly recommend once you get your Aetna ID card, you visit the website listed here and enroll, and then download the app to your telephone. It'll be easier when you need to utilize the services. So general medicine is at $40 or less. So $40 if you're on the high deductible health plan. If you're on the other plan, that's a $25 copay or $40 copay. That's what $25 copay. That's what you will pay. So worst case scenario on a general medicine visit in telemedicine is a $40 copay. They can treat many things: flu, allergies, sinus infections, rash, or throat, and much, much more. And then they can prescribe medications and send it to the pharmacy that's closest to wherever you are. If you're traveling on vacation anywhere in the U.S., you can utilize the services. They also have dermatology at a $75 or less copay, depending on what plan you're enrolled in. And of course, they have other services like behavioral health and psychiatrists as well. Again, 24/7, 365, and it's part of your Aetna plan. Any questions on the telemedicine? Okay, next we're going to talk about your health savings account. So if you enroll in the high deductible health plan, the $5,000 or $3,500, you can open your UMB health savings account. We actually advise it. And if you currently have a health savings account, you can also roll those funds into UMB. We will, if you enroll in that and you elect any dollar amount and you do not open a UMB account, we will not be able to transfer those dollars into a holding account. You have to open that UMB account. Once you do, we will get notification that you've opened it. We'll be able to put those dollars in there for you to utilize. Okay, you must enroll in a high deductible health plan. You must not be covered under any other PPO type plan with anybody else. You must not be enrolled in Medicare or somebody else's dependent on their tax returns. Those are exclusions that will not allow you to enroll in a health savings account. You can still enroll in the high deductible health plan, but you cannot put pre-tax dollars aside into your UMB account, okay? Like everything else, there are some IRS limitations. For the 2019 plan year, the maximum pre-tax dollars you can set aside as an individual is $3,500, and as a family, $7,000. So under IRS rules, a family is one plus, so you plus a spouse or you plus a child. Now, I do recommend if you and your spouse or domestic partner are each enrolled in a separate high deductible health plan, that combined you do not exceed that $7,000. Anything in excess of the $7,000 when you file your tax returns will be taxed at 40%. Additionally, if you're 55 plus, the IRS allows an additional $1,000, which is what they call their catch-up provision. So it allows you to put an additional $1,000, so making it $4,500 and $8,000 into your health savings account. Again, pre-tax dollars, lowering your taxable income. With UMB, when you open your account and you reach that $1,000 threshold, you will have the ability to start investing some of those funds. Any interest earned on those funds is tax-free. And then upon retirement, when you start withdrawing those funds, those are also going to be tax-free. So it's a triple tax savings. Very important, if you're Medicare age and enrolled in any part of Medicare, you are not eligible for HSA account. Any questions on health savings account? Also want to point out that if you open the UMB account and you leave the company and you have any dollars in there, that's your money, it goes with you. You can take it with you, continue to add to it as long as you enroll in the high deductible health plan. So there are no use it or lose it provisions with the HSA account.
So, Leticia, how do you open a UMB account?
Did you receive a benefit guide, an electronic multi-page guide?
I don't know.
Okay.
Maybe.
So Susie probably sent it out, so I'll send a reminder to Susie to make sure everybody gets the enrollment guide, the enrollment form.
We're in a different
everything.
office. We're not in that office, so we didn't get one. Gina didn't get one, I didn't get one, and John didn't get one.
Okay, I'll make sure everybody gets one emailed to them. Because it was in that benefit guide, it's a multi-page document. It basically has all of the information I'm going over in much more detail. And I also sent over the SBCs and then the summary. So I'll send Susie a quick note with all of the attachments so she can just forward. Or would you like me to forward it to somebody in your office? Maybe you, Debbie?
Yeah, send it to Debbie at 401k Advisors, Arizona, please.
Yep, I'll send it to you.
And you know, we didn't get a summary on the OAMC 3500. Yeah, the 3500. We got something different that apparently wasn't right.
Okay, I'll send over the SBCs for the medical plans.
Okay, we got a bunch, but I think one was a mistake. We just need that OAMC 3500.
Okay, I will send it over to you.
Okay, thank you.
You need the summaries for the dental as well?
No, we got dental. Is there a summary for vision?
I'll send over the vision flyer.
Okay.
It goes into more
Those,
detail.
I think those are things we're all missing, because I'm looking at the email and I didn't get the 3500 or the vision either. So I think we all need that stuff. Thank you.
Did you get the benefit guide? Is the benefit guide in there?
Not on the email.
Okay.
No.
It might be in my mailbox, but it's not in the email.
Okay, I'll send it over in the benefit guide. I'll send over the benefit guide. And then, do you have the enrollment forms?
No.
Not electronically.
Okay, I'll send those over as well. So I'll send everything over to Debbie, and then Debbie will send it out to the team. Will that work?
She's in a different office. If you
Yeah.
could resend it to Susie so that it can go to all of us, that might work.
Yeah. Send it both directions, please.
Okay, so Susie and Debbie, I'll send it.
Yes, thank you.
Okay. You're welcome. All right, I'm going to move on with the next slide, which is the dental plan. We have the option of two dental plans. One is the Aetna PPO Max, and the other one is the Aetna DMO, both of them using the Aetna network. The PPO is your traditional dental plan where you have a set dollar amount to utilize towards your services. In this case, with this plan, it's $1,500. So your preventative care, such as your cleanings twice a year and your x-rays, are covered at 100%. Your basic services, such as a filling, is covered at 80%. Your major services, such as dentures or a crown, is covered at 50%. Again, all these services deducted from the annual maximum of $1,500. Now, for basic services and major services, you do have a one-time annual deductible. It's $50 for a person or $150 for a family. And again, you only pay that one time a year, only if you use basic or major services. The next plan is the Aetna DMO. It is a smaller network. You do have to pick a dentist and stay with that dentist. They will coordinate all of your care. There is no annual maximum on this plan. There are no deductibles on this plan, and it pays a little bit richer, but the network is a little bit smaller, so you have to find a provider. I recommend when you go online and look at providers that you also give them a call to make sure that they're still within the network. The preventive care, again, is covered at 100%. Both your, everything is listed there, your fluoride treatment for children, space maintainers, sealants, things of that nature, and of course your cleanings twice a year and your x-rays. Your basic services, such as a filling, is covered at 90%. You pay 10% of those costs. Major services is a 60-40 split, so Aetna will pick up 60% and the member picks up 40%. The DMO plan does have an orthodontia benefit. It's a one-time $2,400 copay, and then Aetna picks up the rest. You are required to stay enrolled in the plan along with your dependent for at least 2 years or the duration of the treatment. Again, this plan does not have an annual maximum, which means you can utilize the plan as much as you want. Any questions on the two dental plans?
Yes, please. This is Karen again. I'm in the lovely process of going through some dental work that I've already started in February, and it's going to be finished through the rest of the year. Do I need to get you the EOB for that too?
Solely if you've already paid the deductible, definitely. But the $1,500 maximum starts July 1st, so you'll have that to utilize towards the end of the year. So your dentist, I would reach out to them and make sure they're within the PPO network if you're going to enroll in that PPO max, and then you have a new maximum to use for your services. Since you are enrolled in a dental plan, there should be no limitations in regards to the major services. If you had not been enrolled in any dental plan and you were going to go straight to major services, there would be a waiting period for those services, so you should be fine.
Okay, thank you.
You're welcome. There's just going to be a continuation of care with Aetna.
Okay.
All right, the next thing we're going to go over is your vision plan with iMed. I'm using the Select network. Again, once you get the guides, you'll be able to see this information, and then I'll send over a summary as well. So there at the bottom of the screen, some of the providers that are within network here in the Valley, pretty large network within the United States. They're pretty strong here in Arizona as well. So your eye exam, it's a $10 copay, available every 12 months. Your frames, available every 24 months, is $130 allowance. And then if your frames are more expensive than that, then you get a 20% discount above that. Your lenses, such as single vision, bifocal, and trifocals, are a $10 copay. Standard progressive lenses are $75 copay. Then your contact lenses in lieu of your frames and lenses every 12 months. Medically necessary are covered at 100%. And then your elective contact lenses, you have a $145 allowance to utilize towards that service. And then if you exceed the $145, you get a 15% discount. Okay, pretty self-explanatory. Any questions on the iMed plan? Okay, next we're going to go over life and AD&D with Unum. So the company will continue to provide the life insurance for all eligible employees in the amount of $50,000. So in that enrollment packet, I will make sure that you also get the Unum beneficiary form. We do need that back, and we'll keep that for our records. Additionally, you have the opportunity to purchase supplemental life insurance up to 5 times your annual earnings, up to $500,000. $200,000 of that being guarantee issue. What that means is that you will not have to answer any medical underwriting or medical questions or any kind of blood draw. So again, 5 times annual earnings up to $200,000 for the employee's guarantee issue. For spouse, $25,000, and for children, $10,000. If you enroll even in the minimum of $10,000 this time around, that will allow you to continue to increase your coverage up to the maximum GI of $200,000. Again, no medical underwriting and no medical questions. If you do not enroll this time around, and next time we come around and present the opportunity, you will have to answer some medical questions. Any questions on the life insurance or AD&D? Okay. Disability benefits are still covered by the company. You have the ability, the company will provide short-term disability and long-term disability. So the short-term disability kicks in on the 14th day, pays up to 60% of your pre-disability weekly earnings, up to $1,300 a week, and the duration period of the coverage is 24 weeks. Now, if you should still remain disabled, you will dovetail right into the long-term disability. The long-term disability covers 60% of your pre-disability monthly earnings, up to $4,500 a month, and the plan does cover you until normal Social Security retirement age. Any questions on life or disability? Okay. These are some additional coverages that we offer through our office. AFLAC is one of them. There's a couple of examples of what AFLAC offers: disability, accident, hospital confinement, cancer. If you have any interest in any of the coverages for AFLAC, send me an email and I will make sure an AFLAC representative reaches out to you. We also offer Legal Shield, ID Shield, so again, protects you. Legal Shield gives you unlimited legal consultation, standard will prep, lettered writing consultation with attorneys. It's unlimited. There's a link here, and there's also going to be one in your guide that's going to have more information. And there at the bottom are the prices for the Legal Shield and ID Shield. Additionally, we offer United Pet Healthcare through United Pet Care, and it's very simple to enroll. It's either the link or the phone number, and the prices are based on how many pets that you will be covering. So it covers anything from lizards, cats, dogs, horses, goats, whatever kind of pet you have is usually covered. They have a pretty good network here in Arizona, so your provider may already be within the network. And the prices start pretty low, about $10 is what I pay, and I have one pet covered. And they also provide discounts on prescriptions for pets, you know, allergy medication, things of that nature for your pets is also available through United Pet Care. Any questions? Okay. Once everybody receives the enrollment form, please complete either an enrollment or a waiver. We must get that back from everybody. And of course, the beneficiary form. If you're not enrolling in anything else, those are the only two things that I need from you. And of course, we need everything back by tomorrow. Okay, so I'll make sure to get everything to you today as soon as I hang up here, or as soon as our call ends. So you have the ability to complete your forms and ask any questions if you need to ask. Any questions?
Yeah, some of us aren't in the office. The 6/18 deadline might be challenging.
I'll have to work with our HR team and see how we're going to be handling that. The reason we need that, we need to be able to provide the information over to Aetna, so everybody has their ID cards and is effective 7/1, because your current coverage will term at the end of this month. So if you are not in the office or have a challenge, I know there's one person on vacation. He sent me a separate email. I'll make sure to forward that to our HR team so they know that he's going to be a little bit late because he's not in the office till Wednesday, I believe. Anybody else has?
Yeah, I'm not in the office until tomorrow. Can we email them in tomorrow?
And who is it? I'm sorry.
Sorry, say what?
What is your name? Oh, Karen.
Karen.
Okay. So Karen, okay, I'll make sure that we have a running list of anybody that's on vacation, not in the office, needs an additional day, so we know that you're going to be sending it to us by the 19th.
Can it be emailed to you once it's completed?
Absolutely.
Okay, thanks.
Everything can be emailed, and within the body of the email, I'll provide you the email link of where everything, to whom everything goes to in our office, so they can start to enroll everybody in the plans. Any other questions?
Do you need to have, for payroll, like blank checks, all that stuff has to be set up by tomorrow too to get paid? Is that correct?
Yes, we also need to collect that as soon as possible.
Okay.
Ms. Kirby?
Yep.
Okay.
I don't have checks. What can we do instead of checks then for you?
You can get a screenshot from your phone or your computer of your bank information that has your account number and your routing number, or you can stop by a branch and ask them for a direct deposit form. It takes them about 5 minutes to produce and give it to you. You can scan it to us, or again, you know, whatever's easiest for you. If you, a lot of people don't have checks, but we do need to confirm your account number and routing number so there are no errors with that first payroll.
Perfect. Thank you.
Okay. You're welcome.
This is John Scott. I'm in Europe until the 2nd of July.
Bob, do you know what you want to enroll in?
Probably.
Do we have your email that I can send you everything and you can take pictures of it, attach it to an email, send it back to us as soon as you can?
I'll try.
Okay. So I'm just making a note to make sure that you get everything you need as well and get everything in by, as soon as you can. I'll notate you're out of the country.
Why don't you copy Debbie on that that you send to me, and I'll work with Deb so we can get as much information to you as soon as possible.
Will do. Any other questions? All right, I'm going to send an email as soon as we're done with the call. I'm also going to send a link to what we just went over. If there's anything you're missing or you have any questions or concerns, whether it be with the plan or pharmacy, send me an email and I'll work with you so we can get everything in as soon as possible so we can get everybody's enrollment completed.
Perfect.
All right, thank you guys. Have a wonderful day.
Thank you.
Thanks.